Room 7107 RN. Hi Angie, this is Dr. Marr. Can you talk for a second? Okay, I'm going to see the lady in 7107. Can you join me? Okay, great. I'll meet you at the room in a minute. Thanks. Bye.
Hi, Dr. Marr.
Hey Angie, thanks for coming.
Yeah.
I'm going to see Ms. Kingsley. She's a lady with cholangitis and septic shock who's transferring from critical care to medicine today. How's she doing?
Mrs. Kinsley is doing really well. Her pain has much improved. Vital signs have been stable, no more fever. Also, she has an order for to transfer to progressive care,
Okay.
but I was thinking maybe we could look at general care
Okay,
instead.
I'll give that some thought.
Okay.
Anything else?
Yeah, she's still on a clear liquid diet. Gloria, her wife, is here today and is quite concerned that she's eaten next to nothing for several days. Gloria's a really good cook, so she pays particular attention to her diet.
Okay, great. Are you free to go in with me?
Yes.
Okay, all right, thanks. Oops, that way. Hi, it's Dr. Marr from Hospital Medicine. Is it okay if Angie and I come in?
Yeah.
Okay, thank you. Hi, Ms. Kingsley. I'm Richard Marr from Hospital Medicine. Nice to meet you. I'm going to be the doctor in charge of your care now. I'll give you a card here. Is it okay if I pull up a chair and spend a few minutes with you?
Oh, this is really nice. There have been so many doctors.
Who's with you here today?
Oh, this is my wife, Gloria.
Gloria, nice to meet you.
Nice to meet you as well.
Thanks for being here. I had spoken with Dr. Ham's critical care team, and they said that you're doing so well that you won't need their services anymore. So I'll be your physician. Is it okay if we talk about your care with Gloria here?
Yes, of course.
So I understand the surgeons are going to come by and see Carol today. I'd really like to meet with them as well, but I can only stay a few hours.
Okay. When we're finished, in a few minutes, I'll give them a call and I'll let them know and see if they can come while you're still here.
Thanks.
Great. How are you doing?
The pain's gone since, I'm feeling a lot better since they got that gallstone out.
Okay, terrific. Any discomfort in your chest at all? Any trouble breathing?
No, that's okay.
Okay, great. No pain, you told me that. Any nausea or vomiting or any constipation or diarrhea?
No, none of that. The pain's gone. Starting to get my appetite back. So, why do I need to see a surgeon? I thought Dr. Jeffrey took care of everything.
That's a good question. You seem a little worried.
Yeah, I guess I'm nervous. I haven't had any operations before, and, I just want to be done with all of this and go home.
I understand. It's normal to be worried. I think you might benefit from having your gallbladder out while you're here in the hospital. But I'd like to examine you first and then talk some more after that, if that's okay.
Okay.
Okay. All right. I see you've still got this catheter. This is called a Centraline in a vein in your neck. They put that in the emergency room when you're really sick and they needed to treat you really quickly. But I think probably at a point now where we can get it out because it's maybe more likely to cause you a blood clot or even an infection if we keep it in too long. Angie, do you think we can get a peripheral line in her today and maybe get the central line out?
Yeah, sure. How about our Foley?
Good question. So peripheral line is a regular IV, typically in the arm. I think it'd still be good to have one available after we take the other line out. But the Foley is the catheter in the bladder. Unless you normally have one in your bladder, I don't think we need to continue to use that one.
No, I don't have any problems with my bladder, but it's kind of convenient.
That it is, but I think you're at a point now where, again, I think there's some risk that it might cause you an infection. So you needed it when you were sicker, but I think it would be a good idea to get that out as well.
Okay.
I'm going to listen to your lungs, if I may, and have you lean forward. Maybe take some deep breaths with your mouth open. I'm just going to check the skin a little bit lower down here, make sure there's no sore. Okay, that looks good. Can I have you come back? I'm going to listen to your lungs now. I mean, to your heart. That's what's up. Give me just some regular breathing, if you would. Okay, lungs are clear, heart sounds are normal. I'm going to examine your abdomen. Keep up, please. Okay, don't seem to have any tenderness there. That didn't hurt. Okay, I'm going to just check on your feet as well, too. And I'm going to undo these a little bit and look at your heels. Is that okay? Okay. That looks good.
My feet have been kind of cold, so.
Yeah, now they're colder from my cold hands, sorry. Get you covered up again to warm me up. Pulse is good. Okay, extremities, yep, they look fine too.
So, hey Doc, when can she eat some real food?
It's another good question. I hear you're a great cook, Gloria, and appreciate your concern. Carol, I'm worried though that you still got gallstones in your gallbladder, and I think that if you eat a regular meal, it may actually get you into some trouble again. Let me draw you a picture. I'm just going to move this over here, and so this is a diagram of your gallbladder, and there's some ducts that come out of it. This one goes to the pancreas, and then it comes down and empties basically into your small intestine. Not this big, no artist, but here's a gallbladder and here are gallstones. Okay? Here's the common bile duct, which is where Dr. Jaffrey was able to get in with a scope yesterday, get stones out, and put a stent in.
Okay.
Okay?
Mm-hmm.
What I'm worried about is whether or not any more of these stones might come out, get stuck again. And so I think it would be wise to have the surgeon see you and think about getting your gallbladder out while you're in the hospital. And in the meantime, keep you on a clear liquid diet. If they think you should get your gallbladder out and you agree, then get that done soon. And then as soon as possible after that, get you back on a regular diet. It's probably not what you wanted to hear, but I think it's what makes sense, at least to me. And I'm just wondering if I said it in a way that makes sense to you. Do you mind telling me back in your own words, Carol, what you heard me say?
Yeah, so I can't eat until I get this gallbladder out?
Well, not exactly. I think you may benefit from getting your gallbladder out while you're still here in the hospital, but I'd like to get the opinion from the surgeons and see if they have a different idea.
So,
So, where do these gallstones come from, and why do they keep getting stuck?
Okay. Another good question. Try to give you a good answer. What I didn't draw in here is the liver. The liver is up here, and the gallbladder sits in a pocket in the liver. The liver makes bile, which is a digestive juice, helps you break down food. And some of the bile gets stored in the gallbladder. There are chemicals in the gallbladder that sometimes come together, and they form solids or stones. The gallbladder normally squeezes or contracts when we eat certain foods to help deliver bile down into our intestines. But if it squeezes out a stone, there's a risk that that stone could come through and get stuck in one of these ducts. And if that happens, it could cause swelling, pain, and even a serious infection like the one that you came in with. So I'm glad you asked these questions. I hope I did a better job of explaining things the second time around, because I want you to understand about your care.
Well, yeah, thank you. So, I can't eat food until I talk to the surgeon, and then after I talk to the surgeon, the decision will be made whether or not they need to take my gallbladder out,
Mhm.
and then after that, I'd be able to eat.
That's pretty much it.
Okay.
Before I leave, I'd like to go over a couple of things on a safety checklist with Angie, just make sure we've got things covered. But what I'll do is I'm gonna call the surgeon, and actually I'll call Sarah. She's the physician assistant on the surgery team, and let her know that we'd like to have her come up while Gloria's still here. And I know this is a big deal for you, and it's serious stuff. But I work with the surgeons a lot. They do great work. This is the kind of problem that they deal with all the time. And and I would trust them with my own care.
What do you think, Gloria?
Well, it makes sense to me. I don't ever want to see you as sick as you were.
Okay, bring on the surgeon, I guess, and keep that Jell-O coming.
There's the spirit. I'm going to go over a couple of things with Angie here on the list, if I may. Okay, so on the checklist, S for skin, I didn't see any sign of any skin injury, anything that you've seen, Angie?
No, I
any
think her
concerns?
skin looks really good.
Okay, great. A is for access, we talked about that central line, we're going to get that out. F for Foley, that's coming out too. E for eating and elimination, no problems with diarrhea or constipation, and we hopefully will be getting you to eat later. And for T, you've got a few things. One is tethers. You've still got this monitor on your heart. I think that's been okay. No rhythm problems, so we're going to discontinue that, and of course getting the catheter out and the central line out. Also for therapies, do you think Carol needs any physical therapy or any other therapies?
No, I think Carol's been getting out of bed really well on her own, so I think if anything were to change, I'll let you know, but I think she's okay for now.
Okay, great, let me know. And for thrombosis, that means clot. We've been giving you this blood thinner with the shot in the abdomen. Once you're up and moving around, walking about 3 times a day, we can stop doing that then. And last part here on the check mark, checking on antibiotics. I'm glad we saw this, I'd forgotten about it. She's been getting IV antibiotics. We can switch those to pills now. And I'll talk to the pharmacist and just make sure we get the dose and the duration right. And then finally, checking on status. You suggested, Angie, that she could go from critical care straight to general care. I agree with you. I think you're right there, too. So general care just means you'll still be in the hospital, but you'll be in a different room, maybe even on a different floor. But I'll still be your doctor today. But I'm sorry to say today is my last day of my work week.
Oh, great, another doctor?
Yeah, I'm really sorry about those changes, those transitions. But Dr. Becky Jones is one of my partners. She's fantastic. She's going to take over for me tomorrow, and she'll be here for a week. So I'll throw her name up here on the board too,
Okay.
and I'll let her know tonight when I call her about your case. Okay.
Okay,
All right. What other questions do you have?
I think I'm set.
And you're going to call the surgeons, right?
Yeah, I'm going to call Sarah. She's the physician assistant on the surgery team.
Oh,
And I'll
okay.
just see if somebody can come up. All right. Very good. Very nice meeting both of you.
Nice to meet you too.
Keep getting better, okay? Thank you so much for being here. Yep, being here for. I'm just going to throw my name up here on the board. Sorry, Becky Jones's name. She'll be here tomorrow. Okay, Angie, did I forget anything?
No, I think we're good. I'll work on getting central line out today, and then we'll take out your Foley, and I'll work on getting the bed to general care. And if you could just please put those orders in, that would be great.
Okay, I'll do that, and I'll get in touch with the case manager, let her know maybe a couple of extra days in the hospital before you go home, maybe a couple more.
Okay.
Okay? Thank you. Thanks very much. All right.
Thanks.
Bye-bye.
Take care.
Is there anything else you guys need before I go? Anything else I can do?
If you could give me another glass of water, that would be great.
Yeah, do you want ice in it?
Jell-O.
And some Jell-O? Okay.
Yeah.
All right, I'll go get those and I'll be right back.
All right, thank
Okay.
you.